Consulting, past president of the club, chair of the District 6710 Membership Committee. She's a recipient of the Rotarian of the Year Award and a Paul Harris Fellow. To introduce our featured speaker, Alice.
Thanks so much, Julie. It's a pleasure and an honor to introduce our guest speaker today. The proverb, "May you live in interesting times," was perhaps tailor-made for those on the front lines in the public health battle with COVID-19. Thank goodness we have leaders like Eric Friedlander who seem born for this moment. Eric was appointed Secretary of the Kentucky Cabinet for Health and Family Services by Governor Andy Beshear on December 10th, 2019. Where were we then? Oh yes, just a few months before an international pandemic. Eric has spent 35 years in public service, most of them with the cabinet. He served previously as CHFS's Deputy Secretary in the administration of Governor Steve Beshear, where he helped lead and manage successful implementation of the Affordable Care Act and transformation of Kentucky's healthcare delivery system. He's held many other positions in cabinet agencies, from Certificate of Need to Family Resource Centers, with an emphasis on specialty areas from budget to policy. I got to know Eric during his service as Chief Resilience Officer for our city's Office of Resilience and Community Services, a role he held just before his current one. In that role, he led Louisville's participation in the 100 Resilient Cities Initiative, a worldwide network of cities studying the factors that help cities bounce back from the inevitable impact of acute shock or chronic stress of aging infrastructure, inequality, and poverty. He also led the city's response to homelessness, which included poverty-fighting initiatives like LIHEAP, a program that assists families with energy costs, Meals on Wheels, and Louisville's Neighborhood Place, as well as advocacy office with the Office of Women, Veterans Affairs, Aging and Disabilities, and Youth Development. Secretary Friedlander is a graduate of Antioch College and lives in Louisville with his wife Indigo and their cats and dogs. Eric, we welcome you to the Rotary Club of Louisville.
Alice, thank you so much. It has been a joy to work with you over the years, as well as how much I appreciate your career in bettering healthcare across Kentucky, bettering healthcare in Louisville. Thank you so much for all that you have done. I just want you to know how much I appreciate that. Rotarians, also thank you. You have a long history of making a difference in health across the world. We saw that from Denise's presentation, as well as then what you have done in the past in terms of making sure that we have a strong response to the polio epidemic. You all brought a lot to that and helped us just about get to the point where we have conquered polio. So your all's work there, the work in Ghana, is something that I think you can all be proud of and we can all share. So today I'm going to give you a little update. Alice, yes, I think my timing of going to the Cabinet for Health and Family Services during a worldwide pandemic was not the best, but so happy to be able to lead. I see a lot of friends from my time in Louisville in the participants today. So greetings to you all. It is good to be back and addressing friends in Louisville. So once I figure out how to advance, we will start. He says, all right. Well, perhaps it's this button. It is. Hooray. So, Alice, as you pointed out, December, we didn't know what was going to happen. In 11 short months, we've gone from our first case in Kentucky to now being able to vaccinate over 10% of Kentucky's population. That is a scientific miracle. We have never in the world developed vaccines so quickly, and now in the process of distributing them so quickly. So we're working on three pieces, and we'll talk about this today. You'll see as we talk about it where our vaccine supplies are, how we plan to build out sort of the regional and local vaccine sites, and how we're going to ramp those sites up. And we can give a little demonstration. I'll show you a little bit as we go through of how we've ramped up just over the recent weeks. First thing, supply. The vaccine supply does not come anywhere near close to the demand at this point. It is a challenge. It is one of the biggest challenges we have right now. We wish that we had more supply, but even the fact that we've had as much as we've had in this short period of time, I think we really should celebrate as really making a good start. And the important thing as we move on is making sure that folks continue to want to receive that vaccine. You know, it's kind of a hard message to deliver. Get vaccinated, get vaccinated, get vaccinated. Oh yeah, and wait until we have enough supply. But that's where we are today. And hopefully within the next couple of months, we'll see that this supply bottleneck will start to ease. So Secretary Gray, Jim Gray, who is really leading this project for us, and I'm so thankful for that, has talked about how when he talks to partners, when he talks to UPS, this is described as one of the most complex distribution efforts anyone has ever undertaken in the history of the world. And to give you a little idea of how complex, right? We right now have 2 vaccines. They require different refrigerations. They require different handling. Once you thaw, you have to use all those doses in a specific amount of time. They come in really tranches of limited. You get a specific amount, and then trying to get this out to populations, looking at populations density, and then trying to figure out, well, what's the first dose and what's the second dose, and all of these pieces that we have to put together. And so Jim has been doing a most able job in leading this. And of course, I would be remiss if I didn't mention, you know, our rock star locally, Dr. Stephen Stack. He has great hair. It is not a prerequisite for working at the Cabinet for Health and Family Services, but I will say it helps. So we've been very fortunate to have really, really excellent leaders and a governor that has led and been dedicated to communication this entire way through. So we have started out, much like how we started out with testing site and PPE and things like that, we started out with some real challenges. And we've really tried to expand and build upon the strength of what we know we can do over time. So we are identifying new sites all the time. And right now, we really do have more capacity in many ways to give vaccines than vaccines that we have. But I want to give you a little example of how we've expanded over time. This is where we started, right? This was some of the existing sites, some of the existing regional sites that began really at the beginning of February. As we moved through, we started adding some more sites. You can see we're getting better coverage across the state. And we're starting to fill out across the state of where folks can get vaccinations. Then as we started to bring on our local health departments and start to give them a regular supply of vaccine, they started to be able to provide vaccine across the Commonwealth. You'll see that not every county is covered, but that's because our local health departments are regional oftentimes. So there are 61 health departments across the state, and oftentimes they cover multiple counties. So the allocation, the minimum allocation that we've been giving to local health departments has been, represents 100 per 1% of population in Kentucky, rounding up. So we've tried to assure them that we will be giving a very stable supply to them and ramp up as more vaccine becomes available. As we have moved on, here are the new sites that we started in the week of February 8th. Again, you'll see that we added many new sites. A lot of this had to do with the federal pharmacy program. So they're really good neighbor pharmacies as well as Walgreens pharmacies. And we really begin to fill out, right? Now, doesn't mean that supply is increased dramatically, but it has increased some. So we're able to supply a few more sites. So we are beginning to ramp up that supply. You know, you've seen where we announce an additional 5% that we celebrate, or an additional 29% that we celebrate. But to get to full capacity, we are still a long way away. And so we are continuing to go through sort of our phased implementation. I think you all hopefully have heard us say this, but that phase 1A, our long-term care, we've actually very, very close to finishing our long-term care, particularly in nursing facility, that vaccination program. We're in the third. We were doing 3 clinics, and we're in the third for every nursing facility now across the state. Most of our residents are vaccinated now, and you can see that in our daily updates. You see the impact in long-term care now really starting to diminish. So it's good news. It means the vaccine works, and we are having impact. In phase 1B, we've started the first responders. Of course, we want to get everybody back to school, and we just recently brought in childcare providers so that we can begin to really try to get our kids back into school. It is very important, and I think we all share that desire. And again, those folks that are 70 and over, and when you think about this 1A and 1B, this is a little morbid, but a majority of the folks who have the most significant impacts from COVID and who actually go into the hospital and have the greatest risk of dying, this is in the 1A and 1B category. So we really are focused on that 1A and 1B. I am in what phase 1C, as you can tell by the beard. So we are going to open up that phase 1C here really pretty soon. And that phase 1C is a lot of people. That's probably over 1 million folks in Kentucky of our total population of 4.4 million. So that is going to take a while. It will be vaccine dependent. I'm hoping this late summer we may be able to move up, but right now this is what it looks like. There's a lot of people to get vaccinated, so we need to keep the enthusiasm going. I'm hoping that this first, I like to say the first phase 1A and 1B, we're practicing what the distillers in Kentucky do sometimes, which is drive demand by scarcity. You know, ask the Van Winkles about that. So hopefully this desire and the push to get vaccinated, this will continue, and you'll start to see some of our push to get folks vaccinated. And now, here's where you can get more information. We do try to encourage everybody to go to that covid19.ky.gov site. There's a tremendous amount of information. Maps, who's getting vaccinated, who's getting tested, where our cases are in Kentucky. That is a place you can go. You can also bounce off to that vaccine site to find vaccination sites that are near you. You can sign up and determine your phase level. We also then, for folks who have trouble navigating the websites, we have a call center that people can call. When we first opened it up, we were certainly swamped, but we are now really able to meet the demand there. And of course, we always encourage you to watch our daily updates. I think that they hopefully provide some information. And in closing, I always like to close in this way. This has been, and I feel like I should get like punched every time I say something about unprecedented, but it's a word that we've been overusing for the past year. But this is unprecedented. We have not experienced anything like this since 1918. No, I was not around then. But it is something that we just it is not something that you can prepare for. I think what we'll find out, people will be studying this for 20 years. They'll be studying different states' responses. They'll be studying, you know, probably what happened day by day through the pandemic for a long time. But I think we're going to be proud of how we responded in Kentucky. But I also like to say, I hope we learned something. And I hope what we learn is that whatever happens to one of us in our communities impacts us all. Uh, Denise presented, sort of the global perspective, but I like to think about it on the local and community perspective. We really know there is no better demonstration than a virus that it really does impact us all. How we take care of each other, how we work together. SOS, thank you for all your support through this. It is that we are all in this together. And so I hope if we get a good learning out of this, I know that that's hard to say, but that's what I hope we learn. So with that, I will unshare my screen if I can figure out how to do that. And I'm getting close. There we go.
Secretary Friedlander, we just want to thank you so very much for an informative presentation, but more so for your ongoing dedication. We know you've been working tirelessly for more than a year now. This pandemic has been raging, and we just, on behalf of the Rotary Club, appreciate your great work and also the transparency in which you are working. I know you've been very accessible to the media and to KET, and that's greatly appreciated as well. Would you have some time for some questions from our Rotarians?
Absolutely.
We've got several here in the chat. One wants to, let me go to the very top here. This is from Bruce Engelhardt, and he asked, how are we doing using common metrics versus other states, i.e. West Virginia?
West Virginia has been a really good example of they went their own way. And in some ways, particularly in the long-term care side, they really did a good job. And looking back, folks say, what have you learned? One of the things would be that we probably would have taken that long-term care piece into our own hands. But when you then look at how Kentucky's doing in terms of vaccination rate, uptake rate, as well as then the percentage that folks who shots in arms is how we call it, we're doing very well. When you look at then the other surrounding states in particular, Kentucky really is, if not leading the way, very close to leading the way in many of those categories. So I feel really strongly about our response. And it's not usual for anybody in Kentucky to say, but we do appreciate West Virginia being ahead of us. That's a rare thing that I think that West Virginia should celebrate, and we can learn from. So that is something that I really do believe that we have done quite well here.
Thank you for that. This is from Steve Eggers, and he asked, when will the 1C group begin to receive vaccinations?
Well, what I would say is stay tuned. In the presentation, we gave around March. I think that's really probably right. I would invite everybody on this call to watch the press conference this evening. I think we'll start to get some more information on that.
Oh, very, very good. Since Walgreens and CVS, Walmarts, et cetera, have the existing ways to give the flu vaccines, and they did your healthcare facilities, why not ramp them up as they are all in counties in the state? That comes from Richard King.
Right. Walgreens is a part of the federal partnership. So they are receiving vaccines. And then some of the independent pharmacies, the federal government has selected some of the pharmacies to do that. So those pharmacies have actually started giving vaccines. Walgreens has websites. It's called Good Neighbor, I think is what the name of the independent pharmacy group is here in Kentucky. So they are starting to do that. So with that, some of the federally qualified healthcare, like family health centers, are going to start to receive some of the vaccinations as well. And yes, right now we probably, again, have probably more capacity to give vaccine than we have vaccine itself.
Right. Okay. This comes from Kevin Wardell, and he asked, will phase 1C open up all at once? Or is it such a large group? I've heard the count of 1 million. I don't know if that's right or not.
Yeah.
But
Yeah.
big group. And can you describe that a little bit, or will that preempt today's conference?
Well, we are going to emphasize folks 60 and older, again, just because of the impact of the disease. So that it's an emphasis, not a requirement. It gets so very difficult to try to curate the next level. I mean, who is more important? I think we could ask everyone looking today, and we probably come up with a different group that we would think is most important. So really, it does, with the plus 60, then as an emphasis, we are then it is gonna be generally open to folks in that category.
Very good. This is from Bruce Englehart, and he asked 30% in military refused to take the vaccine. Are we seeing large refusal rates here in Kentucky?
We are seeing some refusal rate in Kentucky, absolutely. As we looked at our long-term care, we were somewhat reflective of the national rates, in that 40% refusal area. We've seen some of that across healthcare, unfortunately, but it is something that we continue to try to push. What we found in long-term care facilities, right? When we did the first round of the clinics, we had a slightly higher decline rate. And then when we came back for the second, after folks saw that there was no adverse impact from getting the vaccine, we started to see that uptake rate increase. And so I think the more we're able to demonstrate that there really isn't a negative impact from getting these vaccines, that they protect us, that they allow us to see loved ones, we hope that will continue and with you all continue to push that these vaccines are safe, they're effective, and they're important for all of us to get.
Yes, that we've seen some new advertising on our airwaves here in Louisville that look really promising. We've also noticed in the media, particularly the White House reports about other states that have not prioritized education in receiving the vaccines early on. And just want to thank you for that, to help us get our economy back and kids back in school. And also the childcare workers being added to the list, because that all, we're all connected, aren't we? It's like, one part impacts the other and getting people back to work, especially women. And are you receiving reluctance in the education field as much as you are in the long-term care area, or is it about the same?
It kind of depends on, it really is district to district at this point.
Mhm.
We aren't quite seeing as much, I think, because folks are so eager to get back to school. But it does really vary by district and county.
Do you recommend, this is from Gene West, do you recommend making a reservation before your group is activated?
Uh, Gene, I think it's kind of falls in the category of don't ask, don't get. So I think I would probably wait a week or so and then begin. Then I think 1C is going to start up fairly soon.
Okay, very good. This is from Riggs Lewis with Norton, and he says, Mr. Secretary, your efforts to vaccinate healthcare workers in nursing home early has sharply reduced hospitalizations and kept healthcare workers on the job. This will only improve as we get more supply. And I think he is saying thank you in that remark. So.
Thanks, Riggs.
This is from Kelly Hutchinson. Do you foresee us still needing to social distance and not have gatherings into the fall, or what's your timeline?
So even with the vaccine, the recommendations are that we continue to do the social distancing and masking. I think it's when we get to a level of penetration of vaccine within our population that we can begin to think about how we ease that social distancing and masking. I don't know as we know when we're going to get there. I would love to say that that's a possibility, but I think we're probably in for a little longer ramp than that.
Okay, very good. This is from Ton Lanham, and he says, how are they working to weed out the people that, I'm sorry, my screen moved right as I was asking the question. Let me move it up. Cheating the system and containing shots outside of their appropriate time period.
So the sites themselves are doing some of that. We really are interested in getting shots in arms, period. So you will hear some stories of some folks who've jumped the line or some site that's opened up because they had extra vaccine and didn't want to waste it. So there are some examples of that, but really what we've seen is impressive compliance with the phases as we've gone through. there's some one-offs, but it is not, it is for the most part, really folks have stayed with those levels.
Okay, and this is from Dr. Charlie Aubert, and he asked, do you consider organ transplant part of 1C? And he also wants to ask why it wasn't in 1A or 1B.
That's a good question. We primarily followed the CDC guidelines on where folks fell, depending upon age and then comorbid. What's the term I want to use? Other factors that influence health. That really does fall in 1C.
Okay.
Depending on
Very
age,
good.
of course.
Thank you. This is from Neville Blakemore, and he asked, over time, do you expect a vaccine will become mandatory to attend big gatherings such as concerts and other events or international travel?
That is another good question that I actually don't know the answer to. At this point, that's not contemplated. As we get through and we find out where probably our hesitancy or refusal rate, if it is so big, I don't know what the incentives will be in terms of maybe it's just a simple incentive of if you get a vaccination, there's some reward for that. I don't know what that will be at this point. It is our managed care organizations for our Medicaid population do that all the time to encourage vaccination, to encourage well child checks, things like that. Those kinds of incentives I can see way before some of the others.
Okay, very good. This is from your friend, John Walzak, and he says, hi, Eric, you're doing a great job. With the wet markets continuing in the global economy, facilitating rapid transport, what efforts do you see going forward to prevent and prepare for potential future pandemic?
Well, these are great questions. Thanks, John. Good to see you too. But I think this is a shock to the system, right? We've had scares around Ebola, other highly infectious diseases where we have the WHO and other partners, Doctors Without Borders, all those folks who go out and try to do very serious contact tracing and try to isolate within communities very quickly. That's going to depend, and I think this will, what I hope will happen is that this will increase the surveillance across the world, increase the understanding of the seriousness of that surveillance and the funding of that surveillance. I think it's true about local health departments in Kentucky. We haven't funded them at the level we need to be able to respond as aggressively as we've needed to. I'm hoping that this highlights the need for those services and highlights the needs for funding that prevention piece of it, that surveillance piece. I know that that's a hard word sometimes and we worry about surveillance, but disease surveillance is something that we've done for a long time in this country, and we need to continue to fund that in ways that are appropriate. A kind of a long answer, John, but I'm hoping that this will set the alarm. This will set the system to the point of certainly being more attentive and better funded.
Thank you. This is from Neville Blakemore, and he asked, when do you think the pandemic will be considered officially over? And at that time, do you think we'll still have to have social distancing going forward?
Ooh, I wish I had a crystal ball on it. What I will tell you is this, we probably need to get to 70–80% of the population being vaccinated before we can start to feel like we have that herd immunity. Can we do that in time and quickly enough that some of these variants don't start to evade some of our systems? I mean, we'll see. I'm hopeful for that. But I think what you need to look at would be what is the vaccination penetration rate in the population before we would know when we get to that point. Sorry, I don't have a better answer, but that's the best I can do.
Well, we're dealing with what we're dealing with, right?
Right.
So,
right.
So this is from Rick Harnett, and he asks, how are we doing at making the vaccines available to citizens, especially in West Louisville, for example, who have very limited transportation options?
Right. There's significant issues particularly as it relates to equity and equitable vaccinations. We look at those rates all the time, actually daily. And I think we publish them weekly. You can find them on our COVID-19 website to see. There are some significant challenges for a lot of folks, right? Particularly with transportation. City Eagle Rentals has been great, and the Urban League partnering with Louisville Metro Public Health. We look to expand upon that and to expand upon sites in the West End. We are looking for sites. As we get more vaccines, I'm sure you're going to see that as we do some of that expansion. We've also had some success with some of what's called the pop-up, but that is working with some of the local churches to make sure that we have vaccination sites where folks can go. You'll see more of that. We have a health equity, Office of Health Equity within the Department for Public Health. We have a health equity champion group that is partnering with the leadership as we roll the vaccination distribution out. So I think we are trying to be as robust as possible. We will then start to do more outreach within our local communities across the country.
That's very important to our club as well. We appreciate hearing that. This is from Alice Bridges, and she asks, what changes have you seen in the federal COVID response and coordination with states since the transition of presidential administrations?
Well, it's early, and I'm not sure. There is some difference, and what we've seen is like with the federal pharmacy rollout, there is some more ownership on the federal level for some of the distribution. That's kind of the first thing we've seen, we've had a robust response in the state. We had good partnerships with the previous administration. We have good partnerships with this administration. What we are most interested in is getting as many vaccines into Kentucky in as many arms as possible. So all those partnerships are appreciated.
Okay, this is from Charles Mack McClure, and he asks, how are we going to solve the problem of older people with no online or knowledge of how to use technology?
Right. So that's why we have the call line, so folks can call in. We're also partnering with some of our other organizations. We've developed a script for, well, if you call the line that was at the end of the presentation, a person will get online with you and walk people through getting signed up to be vaccinated. We're going to be expanding that hopefully here pretty soon, so that folks will have other options of where they call. And so our partners will have a script for how they can go online and assist somebody when they want to get vaccinated. Our ADRC, which is through our Aging and Independent Living, AAAs, we've given them that script for how they can help people sign up to get vaccinated, so that you won't necessarily need to do it online. You can make a phone call and get that done.
Okay, very good. This is from Kelly Hutchinson. How were you able to rapidly organize so many volunteers for these large vaccine sites?
Well, in Metro Louisville, so the broadband site, right? That is a big site. Props to Louisville Metro Public Health. I've worked with them in the past, and I was in the city, and I admire their work over time. And they really they put the call out, and they put the call out for volunteers and folks who could help them. The Inspector General at the Cabinet for Health and Family Services is a nurse, and he's volunteered. And it took him like several weeks to be able to come up to be a volunteer. I think what it does is it speaks to how engaged our community is, and the willingness of particularly this community. I'm from Louisville, so I'll brag on this. This community to really step up and support with volunteers, again, at the SOS program, all those folks that assist and come together. Again, the piece that I hope we learn, that whatever happens to one of us happens to us all. I think in Louisville, we do a really good job and have a really good, strong sense of community and that volunteerism that it takes to help across the community. I saw that in homelessness, right? There are the street outreach groups that really just save people's lives in times like this with the weather the way it is. I know they do. I would go out with them on occasion. that kind of spirit of volunteerism really permeates our city. And I think it's something that we can be proud of.
Yes, very much so. Thank you for that. This is from Bob Royer, and he asked, at this time, is it anticipated that this will be a one-time vaccination like a polio, or will it have to be an annual vaccination? Any thoughts on that?
Another excellent question that I'm not sure we're positive about yet. Obviously, the Pfizer vaccine and the Moderna vaccine require a first shot and a booster. The Johnson and Johnson vaccine when it gets approved is a one-time vaccination. That's going to be more important for folks who are homebound. These vaccines are delicate. If you shake them too much, they lose their efficacy. The Moderna and the Pfizer. The handling of the Johnson and Johnson is much more standard, much more normal, and it's a one-shot vaccine. You'll see us deploying that in some of, like I say, some of the homebound, some of the harder to reach populations. So that's going to be a boon when it comes. But the question really is, are we going to see like a flu shot or any of our other vaccinations that have to happen over time? Or are we going to see another booster that we're going to need? At this point in Eric's crystal ball, I can't tell. We're not planning that way, but it certainly is a possibility.
Guess time will tell, right? We'll see
Right.
as we go along. Well, I just wanted to close out with this last comment and question to please pass along our sincere appreciation to the governor, Commissioner Stack, you mentioned a moment ago, Secretary Gray, and your entire team for your work and trying to keep all families and our neighbors healthy throughout the Commonwealth. Every person, it means a great deal to all of us, and just hats off to you. And please know how much we just truly appreciate it. And the question is, how will there be an opportunity to transition as we go forward to make sure that we stay healthy throughout the community?
Thank you for that. We still need to practice social distancing. We still need to wash our hands. We still need to wear our masks. All of that remains as important as it ever was. This will, if we want to defeat variants popping up, we have to continue to do that until we get to the point of really that population penetration on the vaccination rates. I mean, it'll take all of us, right? All of the partners that we have across the Commonwealth. Norton's has been a fantastic partner, right? Riggs, thank you. The Foundation for Healthy Kentucky, right? Ben Chandler has been a fantastic partner for us. I can't say how much appreciate the partnership with Ben. And all of the hospitals, the Hospital Association. We've really had folks step up across the Commonwealth and offer their help and support in ways, even just for my team, even just the emotional support that we have received from folks who have reached out to us and let us know that they think we've been doing a good job. That is really, really helpful. I cannot overestimate how important that's been for some of the folks on my team. So I just appreciate this opportunity to address you all, and I appreciate the support I know that so many of you have given us.
Yes, very, very good. And we'd love to have you back, Mr. Secretary. I know there's so many other areas that you're over that we'd love to hear more about the health of the Commonwealth and how we can all pull together. So thank you very much for being with us. We very much appreciate it.
Anytime, this was a joy, and it was a joy to see so many of my friends on this call. Thank you.
Yes, please come back. Now, Rotarians, we have a great program next week. Our pre-meeting session will be hosted by Rotarian Kevin Fields, President and CEO of the Louisville Central Community Centers, Inc. And we'll also hear about Lou Needs You with guest speakers Sarah DeVasher Wisdom, President and CEO of Greater Louisville, Inc., joined with Karen Williams, President and CEO of the Louisville Convention and Visitors Bureau. And just want to thank everyone for being on the call today. And Ashley, is it possible that we could show the SOS video at this time? Here we go.
Thank you, SOS.
Thank you so much for supporting.
Thank you, SOS.
Thank you, SOS.
Thank you, SOS.
Así como Juan Viri, eso es.
Thank you again, Denise, so very much for inspiring us. Rotarians, we are adjourned. Be well.